Thank you, and
Over to you.
welcome again, everybody that's joined us today. It's really great to have you all here for launching the 2022 postdoctoral bridging scheme. Neil, would you mind sharing the slides for us, please, so that we can move into the slide set? Great, thank you very much. We can go on to the next slide immediately. So this is the structure of the webinar today. It's a 1-hour webinar. We're first of all going to do some introductions to the team and to Health Education England. David Sines is going to talk to us a little bit about their perspective. We're going to give you an overview of the scheme and what we expect people to have achieved by the end of it. And also we've got a perspective from a previous applicant. And then we'll spend a little bit of time talking about the actual application process, the eligibility criteria, the deadlines. And then we're going to leave plenty of time, hopefully, for you to raise any questions you have about applying or the scheme itself. So thank you. Next slide, please, Neil. So I just wanted to give you a little introduction to the team as a whole. This is a scheme that's funded by Health Education England for the London region, and the contract for this scheme for the next 3 years has been awarded to London South Bank University in consortium with King's College London. The postdoctoral bridging scheme is part of a broader contract that's been awarded to support the development of healthcare professionals outside of medicine who want to get onto the integrated clinical academic pathway. And the overall scheme lead from London South Bank University is Dr. Adele Stewart-Lord, who you saw in the initial panel scheme, and you'll see later on. She's the Director of Research and Enterprise at the Institute of Health and Social Care. And she's the overall scheme lead for the internships, the pre-doctoral bridging scheme, and this postdoctoral bridging scheme. We also have an overall scheme lead at King's College London, and that's Professor Louise Rose from the Faculty of Nursing, Midwifery and Palliative Care. And King's is specifically leading on the pre-doctoral bridging scheme, which you may have seen applications for come out recently. That's just closed and they're going through the selection process. But focusing on this particular scheme, myself, as a Professor of Critical Care Nursing here at London South Bank University, and soon to be Director of Nurse-Led Research at Guy's and St Thomas's NHS Trust as from the end of January. I am one of the co-leads for this scheme, together with my colleague Ben, Professor Ben Thomas, who's a Professor of Mental Health and Learning Disabilities at the Institute of Health and Social Care. So we are the two people that will be focusing on this particular scheme. Next slide, please. So as this scheme has been contracted via Health Education England, I wanted to invite Professor David Sines to tell us a little bit more about that from their perspective. So can I pass over to you, David?
Yeah, thank you, Suzanne, and thank you for the welcome. And welcome, everybody. It's really great to see such a variety of colleagues with us, and there's really been indicated from a variety of professions and across the NHS landscape in London. So Health Education England, of course, works regionally. London is its own region, which is coterminous with the NHS England regional office in London. So our interest is covering the 31 boroughs. I use that term quite deliberately because the NHS works beyond NHS trusts. So our landscape refers to non-medical and non-dental healthcare professionals who work within the NHS, either in direct employment or in contract with part-time contracts with the NHS, which I can define later if we have specific questions. We refer under this scheme, which is the Integrated Clinical Academic Career Scheme, to a host of professions from clinical psychology, our diagnostic technicians, right through to the regulated professions within the Nursing Midwifery Council, and of course our General Pharmaceutical Council and Healthcare Professions Council. So quite a broad range here. Well, what's it all about? Well, HEE works in partnership with NIHR, so our National Institute of Health Research, and in order to enable and develop further multi-agency and multidisciplinary research, we've come together to produce a number of schemes to encourage further training and opportunity to develop pre-NHIR fellowship level. This scheme is postdoctoral, and it's absolutely great to make it very clear to you all that postdoctoral means exactly what it is. It's a training in its own right, leading on to new opportunities. At the heart of our thinking, though, is clinical academic career progression. I think that concept of clinical academic career is going to be very important. And I know when Suzanne moves into her new role at Guy's St Thomas's, congratulations on your role there, Suzanne. I can remember many years ago, Anne-Marie Rafferty and I from King's and London South Bank, where I was once the executive dean, we actually worked together with GSTT to look at the opportunities for career progression, because they were one of the first trusts to have a range of nurse consultants. And you'll be very clear about that, which has changed very radically. But that role was rather lost in translation across the NHS. So the need came for us to review and think again about how we could really start to develop evidence-based practice at a level of mastery postdoctoral. So this scheme really offers the opportunity for progression into NIHR fellowships for research in its own right, but it also, and this is important, offers the opportunity for clinical academic career progression within higher education, leading to opportunities for roles in lectureships, senior lectureships. And we're seeing more and more NHS trusts and primary care trusts in their own right, as we move through our PCN networks, our primary care networks, developing new joint roles with universities to provide evidence-based practice in the clinical setting, whilst at the same time enhancing the quality of concurrent evidence-based learning and teaching for our undergraduate and postgraduate students in our universities across London. To do that, enriching it through multi-agency and of course multi-professional roles is exciting. One final thing I'll just say, because it's often forgotten, we have social care in our space. Watch this space, because social care is just about to develop a new advanced practice role. Now, we're very used to advanced clinical practice roles in the NHS across our professions. The same role will be coming in through pilot form in the next year for social work as well. We're going to have to think how we change the word clinical there, but it's exactly the same concepts of advanced clinical decision-making, differential diagnosis, and pulling together integrated assessments at the highest level. So we do come together in a multi-agency way. So we're delighted to be sponsoring the programme. The programme is sponsored by Health Education England and delegated very capably and ably to London South Bank in partnership with King's College. So this scheme is something we're very excited with and really look forward to following through with you over the next period of time. So back to you. I look forward to answering some questions later on, Suzanne.
Thank you, David. Could we have the next slide? Thank you. He's ahead of me now. So just going to give you a little overview of the scheme itself. So as David has already alluded to, this scheme is for nurses, midwives, allied healthcare professionals and associated healthcare workers, the broad scheme within the London region. And there will be 10 places available on the scheme. And the scheme itself requires the successful fellows to dedicate 225 study hours to the scheme. So really importantly, when you're thinking about applying to the scheme, thinking about your capacity to actually have protected time for this amount of study hours. Now, some of that will be taught content via London South Bank University, but much of it may well be in relation to learning within your own clinical areas. And so the conversation with your employers about this time is really important. Those who are successful awardees of the scheme also will receive £5,000 directly delivered to their NHS trusts. And this £5,000 comes directly from HEE to the trust and can be used as part of a training allowance in whatever way the trust sees fit to support that fellow to be able to be successful on the scheme. Thank you, Neil. Next slide, please. So by the end of the scheme, these are the sort of objectives really, that actually people have an understanding of what is required to be successful for an NIH or postdoctoral application. And we're particularly targeting the NIHR clinical lectureship or senior clinical lectureship. However, some people do also apply to the advanced fellowship scheme. So as long as you're a healthcare professional outside of medicine, if you're thinking that the advanced fellowship scheme may be for you, then that is also suitable. Whilst we appreciate that at the end of the scheme, people may not apply for the NIHR or may have other opportunities through other funding schemes, this is the target for the scheme, and this will be the focus throughout the scheme. We want people to have the necessary experience that actually they can then go on to apply for further formal research training and compete successfully. But we also want them to have a real insight into what it is like to have a clinical academic career, how they can grow their own clinical academic career. And although some people come already with a clinical academic career, some are aspiring to have one. So we have people that are quite a range across that spectrum. We also want people to have really had the opportunity to have worked with established and early career researchers, academics, PhD students, and really be building their networks and their communities that are really required for their development of a clinical academic career, and to also to develop and refine their research skills, their academic teaching skills as well. So these are some of the things that we hope they will achieve by the end. Next slide, please. So this is what the scheme looks like. So you can see here there's a mixture of, we've called it talk content. It's not really talk, it's more facilitated masterclasses. So there's a range of facilitated masterclasses that happen across the scheme. And most of these, we have people come and talk, external people come and talk about different aspects around how to develop high impact publications, how to network, how to collaborate, top tips for applying for these fellowships, experiences from previous fellows, etc. And also a series of debates around contemporary issues related to clinical academia, which are a really important part of developing your networks and collaborations, and also your presentation skills as well. There's also opportunities for shadowing and teaching and research, being affiliated to a research group, either within London South Bank or within King's. You'll be allocated a mentor, again, either within LSBU or within King's, depending on your professional background, what you're hoping to get out of the scheme, and the availability. You'll have opportunity, if you wish, to do PhD supervision, shadowing, and to support teaching and learning within the institutions. We offer mentorship, we don't offer supervision. So we need to be very clear that there's a difference between mentorship and supervision. If you choose to, which we hope you will, go on to apply for an NIHR Fellowship Award, then obviously we hope that you would come to LSBU or King's for a supervisor, but that doesn't necessarily mean that will be the same person as the mentor that you have allocated for the scheme. There's also quite a big emphasis on peer group learning and support, recognizing that you're already very experienced clinicians and potentially academics. And so there's peer action learning sets to enable you to work together to learn from each other and to work through some of the challenges together. Next slide, please. So at the end of the scheme, this is what we want from you: an academic report, which includes a draft application, an e-portfolio of evidence that supports the learning objectives and outcomes of the scheme, and that as part of that, that you have a sort of individually tailored development plan, which you would be required to have as part of your NIHR application anyway. And also that you would contribute to the ongoing evaluation of the scheme, both for LSBU King's, but also for HEE. Thank you. Next slide, please. So at this point, I want to hand you over to Dr. Polly Livermore, who is currently an awardee on the current scheme that's just finishing. Our last masterclass is today, and she's going to just tell you a little bit about her reflections of being on the scheme. So over to you, Polly.
Thanks very much, Suzanne. Next slide, please, Neil. So my name's Polly. I'm a clinical nurse with 24 years experience. I'm currently part-time matron at Great Ormond Street Children's Hospital, and also part-time BRC clinical academic programme lead. So that's supporting nurses and AHPs in my trust to go on and do fellowship programmes and apply for research funding. I completed my CDRF in October 2020. It was a full-time CRF. And what I found really hard was moving from that full-time student into how to become an early career researcher, and what kind of things did I need to do. For me personally, I have an honorary contract at UCL, but I do have significant limited academic links. And while I have supervised master's students and PCAF students, I have minimal PhD supervision experience. And so for me personally, I felt quite isolated from other postdocs. There's not many role models out there across the UK, and people that you can necessarily call on and kind of network and let off steam to, as it were. I had some really clear PhD outputs. I had 3 publications and a chapter from my PhD, but it was knowing about how to then take those further forward. And while the kind of long-term future trajectory for me is still quite unclear in many ways, my medium one was that I knew I wanted to do a clinical lectureship application. Next slide, please. So what the scheme personally gave me, so as I've said to you, I felt quite isolated. The biggest thing for me was the networking. And I was on a scheme with 9 other postdocs. I'm the only nurse on there. But that doesn't matter. I've really enjoyed engaging with these other postdocs and sharing conversations and feeling not so isolated, because we're all in a fairly similar position. We are all facing the similar problems day to day in our kind of clinical work. The talk sessions were really beneficial, and while I teach to junior interns and people coming on to the kind of NIHR ladder at a PCAF level about successful funding applications, actually every time you listen to someone else speak, you take something different away with you. I can publish in peer-reviewed journals, but actually how do you get in the high impact journals? And again, collaborations. I have a lot of collaborations, but how do you manage all of those, and how do you work out which are the most important ones to kind of take forward and really engage with? The action learning sets were absolutely great. So this was a group of us on our own, and we would just have a conversation, and someone would come up with a problem that we were all kind of experiencing, and working out how best, and listening to other postdocs having experience of either going through it or coming up with ideas to help you move forward. Giving that time is really important, and that time to think, and that kind of dedicated time to think and to re-engage with your kind of research, because we kind of go back to clinical duties and get engrossed in what we're doing. And actually it was really good to be able to engage and have that time. The debates we did put me well outside my comfort zone. I've never done anything like that before. I can't actually say I really enjoyed it, but I'm glad I did it. And it was a real opportunity, a lot of work, but it was a really good thing to have done. And since then, I've been contacted by participants who were in the audience of those debates and have asked me to engage with further opportunities with them. So that's absolutely great. And to be able, I worked with Suzanne and joined her internship scheme and gave some teaching to some of the fellows that she had on there. So definitely further opportunities have really snowballed. And mentorship from the scheme is really good to have that time with your academic mentor, but also with your clinical mentor, and how they work together. Obviously, it looks really good on your CV, and the funding that comes from the scheme. So this is applying for another kind of fellowship funding grant, so that goes onto your CV as well. Next slide, please. So my final slide just talks a little bit about personally the benefits for me. So what was really important to me and what I've really taken away from it was a sense of belonging. I didn't feel so isolated. I don't feel so isolated. And that was the most important thing that I was looking for. I found the scheme completely enjoyable from start to finish. And actually, one of my reflections for this afternoon for Suzanne is that I would have liked a bit more, but I've really enjoyed it. It is different. So it's very different to my matron day-to-day clinical role, definitely. And having that time, as I said, to get re-engaged with your research and your ideas. Challenge, definitely. There were definitely moments when I felt challenged, the debate being one of those. Being able to be creative about your research for the future. And as I've said, peer support, we have a really good WhatsApp group. And I know that even after the scheme finishes today, we will stay in touch, and there will be people I lean on and people who lean on me in return. And then the opportunities, as I've said, and the opportunities have come from many different angles. So one of the things we're asked to reflect on is about what opportunities have come specifically from the scheme. That's really hard to say, because so all of us were asked to keep a portfolio. My portfolio is done in a timeline. So the top picture you can see here is a timeline from the beginning when I started. And a lot of those things I was reflecting on were process related or learning or self-directed or some conversations. Actually, the timeline at the bottom of the screen, which is further on throughout my, through the pilot bridging scheme that I did, there's a lot more opportunities that have arisen. And some of those have come directly from the South Bank scheme, but also some of those have come from just increasing in confidence, not feeling so isolated, and engaging with other postdocs and kind of bouncing ideas off and leaning on each other. So thank you.
So I think we're going to go to Ben now, who's going to take you through the eligibility criteria.
Thanks, Suzanne, and thanks for that, Polly. You've made me very excited about the course, about the scheme now. Not that I wasn't beforehand. So I'm just going to talk a little bit about who should apply for the scheme, and I would imagine that the people who've joined us today have had a look at this and already feel that they're probably eligible for the scheme. So first of all, you have to be registered with a relevant professional statutory regulatory body as per the programme requirements. And there's the web link there if you haven't already seen that or have access to it. Secondly, you need to be employed by an NHS provider of health and care services with at least 50% of its services free at the point of delivery. And at least 50% of current role spent delivering health and care services. Working in an NHS primary, secondary or community care organisation within the London region. And if you're not sure about that, then there's a web link there for you to check on that. You should have completed a PhD or ProfDoc, or you will have been awarded either a PhD or ProfDoc by the 31st of January 2022. And then obviously clear motivation to apply for NIHR clinical lectureship or other relevant NIHR award. Clear motivation and potential to be a clinical and research leader in the future, and at least one accepted publication in a peer-reviewed health journal. Okay, Neil, could I have the next slide? Thanks. So this is how to apply. You need to email your application to Tina, so that's nicholson@lsbu.ac.uk by 5 o'clock on Tuesday, the 4th of January. Clearly mark the envelope and label the email as postdoc bridging scheme application. So I must emphasize that you really need to do that. Your application must include an up-to-date CV, which is a maximum of 4 pages, a letter of support from the chief nurse or the director of allied health or other senior member of staff, the name and designation of your proposed NHS organisational mentor, an outline research project plan, including details of any work done to date. And for that, you need to write up to 500 words. And then a 1-page personal statement highlighting your suitability against the eligibility criteria. And I'm sure we'll talk about that a bit later on. So just to say, thanks Neil, just to say what the application acceptance timeline is. So we will receive the applications by 5 o'clock on Tuesday, the 4th of January, 2022. And then the interviews will begin on the 10th of January, that week starting the 10th of January, 2022. Successful applicants will be informed by Friday the 21st that month. And then we're planning the first masterclass on Friday, the 18th of February, 2022. Great, so I'll open it up now to any questions.
Before we do that, it might be just worth me just saying that, because I didn't say before, all of the masterclasses are online, and it's always on a Friday afternoon. So in terms of timing, that's when they will be. So yeah, so if we can close the slide and really open up for questions, really, because we're really aware that we've given you a really brief overview of the whole scheme, but what we want to know is, what is it you want to know about the scheme? And then we can address your questions from there. So do we have any questions in the chat?
We do. We've got quite a few questions in the Q&A box. Our first one is from Danielle. Do you know how many days are set for the masterclasses and taught facilitated sessions? It would be useful to know this to plan the use of the remaining hours.
Yes, so I can answer that very quickly. Actually, there are 7 masterclasses in total. They're each half a day and they're on a Friday afternoon. So the first one's in February, as I said, and then the last one is in December. The mentorship meetings are monthly. They're 1 hour per month, and they would be arranged, negotiated with your allocated mentor. And also the action learning sets are monthly, and they're arranged with the rest of your group. So all of these things would feed into the hours that are part of that total hours.
Thank you. Our next question is from Paula. Can you clarify the funding support? Is it the 30 days, 225 study hours directly to the employer to release time and an additional 5,000, or does the 5,000 training allowance include the employer costs for attending the programme?
Well, that's one for me. So the answer to the question there is that there is one payment of £5,000 made per fellow to the designated employer, and that covers a range of costs. It's not a direct cost to support secondment, but we generally state it's employer support costs. So that includes a contribution, should the employer wish to use that, towards temporary staff to cover your attendance at the university. It could include a training allowance for you with regard to additional research facilities, subject to your employer desiring that. It could be travel costs. It's not defined specifically, but it's one pot, £5,000 towards employer support. So we leave it as broadly as that because we're not able to call it a direct secondment salary replacement fund.
And just to build on that, just to clarify that there would be no additional tuition fees. So all of the tuition and support that you would get from London South Bank University and King's is already, the costs of that is already covered by HEE. So there would be no tuition fees for the input that you get from London South Bank University.
Thank you for clarifying. That's very important. So to be quite clear, for the avoidance of doubt then, each fellow actually is awarded a pot of £10,000. 5,000 goes to the university for tuition fees, 5,000 to the employer towards employee-related costs.
Thank you. Paula says, thank you, really clear and helpful. Another question from Danielle. The application asks for the name of an NHS mentor. Would you like a rationale for choosing the mentor in the application, or will you likely ask this at interview?
So we would definitely explore that interview, I would say. It's really up to you who you choose as your NHS organisational mentor. And people choose different mentors for different reasons. It really depends what they want to get out of the schemes. So sometimes people choose role models who are already clinical academics, can help them to navigate the complexity of the clinical academic career pathway. Others of them may choose to have somebody who's got really good knowledge of the NIHR schemes more broadly, or some people may choose to have a mentor who's in the research field that they're interested in, for example. I think the really important thing is that you choose somebody that is going to have the capacity, the time to actually support and mentor you, because that is one of the biggest challenges. It's really important that you get that support from the clinical trust as well as from the academic institution. So Adele, I don't know if you want to add anything to that from our experience so far.
Yes, no, that's absolutely true. Thank you, Suzanne. It's very important that you have a clear sense of how you are going to do any workplace support, and that you can explore that at interview, because often people come to interview wanting to ask what it looks like rather than having to explain what their plans are in terms of how they think they're going to support that. I'm just going to add one thing. I noticed Tina sent in an email to say the email address was incorrect in the slide, so we just need to update that before we close. Thank you.
Thank you. Our next question, can the NHS mentor be someone from another London trust from the one you work in?
Yes. Full stop.
Nice and straightforward. Okay.
Very helpful, actually, and to be encouraged occasionally too. So that's good.
Fantastic. Naomi asks, if you were employed by a university but have an honorary contract with an NHS hospital and work clinically at this hospital through this honorary contract, can you still apply? Or does your main employer need to be NHS? A lot of researchers have to move to university contracts to complete their PhD/get NIR/HR PhD funding.
Probably one for David again. I think Suzanne would probably.
Yeah, go ahead, David. Yeah.
Respond to. It's quite a challenging one, to be quite honest with you. Honorary contracts can be, of course, interpreted in many, many ways. When I was working as an academic, senior academic, I had honorary contracts. For example, I had an honorary contract as an assistant director of nursing at Imperial. But what it meant was it was purely an advisory role with the chief nurse. I didn't actually undertake any clinical academic activity within the trust itself, apart from sponsoring some research there through my university, which was then Buckinghamshire New Uni. So I think we've got to be clear. I think I would put it to you like this. The rules are there should be 50% of a individual's time actually spent within the NHS itself. Now, if you as a clinical academic or with an honorary contract had a full-time contract on the payroll of a university, but you could demonstrate with the support of your employer confirming this to Suzanne and Adele and colleagues, that you are actually undertaking specific clinical duties for a quantum of time. And I do think that, I'm not going to define that here. Note the rules do say 50% for NHS employment. In other words, I would be comfortable for my colleagues to use their own discretion, but you would have to demonstrate with a letter from your chief nurse from your trust that they were actually, you were actually performing a very significant clinical contribution, not just acting in an advisory role.
And David, if I can just add to that as well, I think that would need to be seen that it would be an ongoing arrangement after the postdoctoral bridging scheme as well, not just for the period of the postdoctoral bridging scheme so that you could get a place on the scheme, because the point of these schemes is to develop clinical academics. What we want to do is to develop research capacity within the NHS, not support the development of researchers from an academic point of view. So there has to be very clear commitment to those people being based in the NHS on a long-term basis.
This is so important, Suzanne, because what we don't want to see here is a hemorrhage of clinical academics from the clinical setting purely into universities or vice versa. So we've had examples, for example, where two very senior advanced clinical practitioners, one from allied health and one from nursing, last year were actually employed directly by a university who was working in partnership with that trust. Now, the challenge was that really left a huge gap in the clinical academic, the advanced clinical practice area in the trust, whereas a conversation after the event could have allowed for 4 joint appointments to have been made by that trust. So it was a very unreasonable challenge here. So what we're trying to do is to encourage exactly this type of thing, to be fair, Suzanne. So if we can identify university employed colleagues who are working clinically, albeit on a full-time university contract, but it's a significant contribution, we must and should be responsive and flexible in our approach to that. But as you say, Suzanne, it cannot be just contrived, you didn't use that term, cannot be contrived for a fixed period of time. It would need to be part of an ongoing commitment to clinical activity and engagement.
We have two questions off of the back of what's just been discussed. So Claudette asked, what if you're a clinical educator at a training hub?
You need to, if you're talking about a training hub, we need a further definition. I'm presuming that might relate to a primary care setting, but I need to know what you mean by that first.
Claudette, if you could pop that in the Q&A box, that would be great. Another question following from that, would we be able to choose the academic mentor too, or are they allocated by yourselves depending on profession and who you have available to help?
So we explore that a little bit at interview. So during the interview process, we talk to you a little bit about, you know, what you're hoping to get from the scheme, what you might be looking for from a mentor, so that we can identify potential mentor. But we're very keen that we allocate mentors using a sort of joint approach, so that actually the mentor suits the fellow, but also the other way around. So.
Thank you. David, to come back to you, Claudette says yes in primary care.
Exactly what David thought. So I'm glad I'm still in touch with what happened. It is my own background in primary care, so I get that. This is quite straightforward, really. If you're employed by a primary care network or by a GP practice, and you are working as a clinician, but actually a clinical educator, the answer is no issue whatsoever. You will be eligible as long as 50% of your time is actually linked to one of an NHS or GP related contract.
Thank you. We have a question from Liz. I thought I'd read something which said your PhD needed to be within the last 5 years, though this was not on Ben's slide. I completed a Directorate of Clinical Practice and completed in 2014. Is that okay?
So last year, there was the essential criteria was that it should be completed within 5 years. Our learning from the pilot last year was that, you know, we haven't had these schemes before, and actually there's a lot of early career researchers out there, clinical academics, that still need the support. And so off the back of that learning, we removed that as an essential criteria. We've kept it as a desirable criteria, because obviously, then it may well be that if you've had a PhD for 20 years, it may not be appropriate for you to be coming onto the scheme. So we've made it desirable, but again, it's that whole idea of flexibility that David was talking about, really understanding you as an individual, and whether or not, how much you would gain as an individual from this scheme is our key focus. So it's no longer an essential criteria, is the bottom line.
Thank you. We have some more questions coming through. Victoria asks, do you think sitting the viva first week of January is too late for me to apply for this year?
Well, you can apply. Obviously, you'll have had your interview, and it is quite, if I'm honest, it is quite late, because you can apply, you can have had your interview, but at the interview point, you won't know whether you've actually passed or not. And we need to make decisions about who's going to be coming on the scheme. So it is very tight. But Adele, I don't know if you have a thought about that, because you'll be leading on the interview scheme, and Ben. So
yes, just to say, I feel usually after a PhD, you need a bit of time to conceptualize what the work that you've done, to get it published, to get it out there. That's just a personal recommendation. There's nothing that says you're not allowed to apply, but obviously that timeline, I feel, is quite tight. So that's just that could be explored at interviewed, obviously, if you meet the criteria for application.
Yeah, Polly, it might be useful to have your perspective on that. Actually, you're on mute, so.
Yeah, definitely. I do agree with Adele. A little bit of time just to kind of consolidate and really reflect on what you've done and where you're at with it. I understand the desire to keep going on that path, and you know, you kind of put your heart and soul into everything, so you want to keep going. it's a fine line, isn't it? I suppose if you don't know where you stand by the time you have your South Bank interview, it's probably not a good idea.
Thank you very much. Debbie asks, are there any academic credits associated with this programme?
So it's not a programme, it's a scheme. There's no award at the end of it. It's a scheme that's designed to support you as an individual. So the short answer would be no. Having said that, and you wouldn't be a student of the university, so you would be registered as a visiting fellow for the university, which would give you access to all of the resources like the library and etc. But you would not be a student of the university, so you would not get credit at the end of it. Having said that, both London South Bank and King's both run work-based learning schemes which have academic credit attached to them, and you have the opportunity to enrol on one of those schemes should you wish to do so, to convert your experiential learning into academic credit. There would of course be a cost attached to that you would have to meet yourselves personally.
Can I just jump in and just say, of course, just to remind you all, academic credit, I understand the question very well, but this is an NIHR and NHS England sponsored programme over an overarching way. So it's a transferable award. So as you heard earlier, that it can be a very useful thing to put on your CV. So it's not just a non-accredited award in that sense. It is a formal scheme that you will be able to demonstrate your achievement through completion. So I'm just thinking here, do we offer a certificate of achievement here?
No, there's no certificate as such, but the fellow will have their own portfolio of evidence and the report that they produce at the end of their evidence of completion. And I think building on what you've just said, David, about that academic credit versus the sort of the value of the experience and on your CV, I think that it's also true to say that, you know, if you've already got a PhD, the question is, why do you want academic credit at level 7? That's, you know, unless you're doing another master's, and why would you be doing another master's at that point? So I think it's the value of the experience really that's the most important thing, and that you can put what you've done in terms of that training experience into your NIHR applications to show how you're developing yourself as a clinical academic.
It's a very helpful explanation from my perspective, because your award, of course, as a PhD is at level 9 already. So it makes complete sense. But my thought was, what would you use this credit towards? I'm not getting into an academic conversation about recognition of prior learning or the award of accreditation, but you would have to award it at a level against a level towards specific learning. So I think your point is a very valid one, possibly a redundant issue, but very important to pick up the experiential learning concept for your CV as part of a nationally recognised award in its own right. Should we take that word award out? Scheme in its own right.
Yeah.
I can see
Adele's nodding her head there.
So last couple of questions. If you do have any more questions, now is your time to ask them. Firstly, how long does LSBU have the scheme? Will it run again next year?
I can take that question, or Adele can take that question. So we have the contract initially for the next 3 years. And so, yes, it will run again next year. It's an annual scheme, as are the other components of the contract that we have, i.e. the internship and the pre-doctoral bridging scheme. They're all annual schemes. So you can expect it to run on virtually the same timelines again next year.
That's good to know. Thank you. And can you remind us how many places there are on the scheme, please?
10.
10. That is all the questions from the Q&A box. So unless anyone has any burning questions and you can quickly fire them in there, Suzanne, I'll hand over to you.
So if there are no more questions, I might just ask the panel members if they want to just provide anything else that's in their head that they think might be useful to you, to anybody. So Ben, is there anything that you would like to say? And Ben is just joining us on the postdoctoral bridging scheme for this year and bringing a wealth of experience from research. But Ben, is there anything you would like to add that we haven't talked about yet?
No, I think it's been thoroughly discussed, Suzanne. Really, I mean, there will be issues, and we are open for inquiries if people, if people couldn't think of a question today. But both your email and my email were on the slide, so I think we've covered most things. But you never know what's lurking there, really, if somebody wants to send in a question.
And I think there's an important point that you said, obviously you can contact us about inquiries, but please do be aware that the university is closed from the 24th of December until the 4th of January. So there will be nobody to field inquiries during that time. So if you have inquiries, please contact us before the 24th of December. Try not to leave it till the 4th of January, because that's the day of the deadline. So. Adele, is there anything you would like to add or from our learning from this current year?
Just to say, it has been a very enjoyable experience having the fellows for the last year, and obviously we've gained a lot from them as well, and we really look forward to hosting the cohorts for the next 3 years, as you've identified. I was just going to add again about making sure you put in your inquiries within the next week, potentially, to make sure we get back to you in time, especially as there might be a lot. And then just to also add, please note that Tina's email was in the chat. If you did want to take that down, make sure that you have the correct email address. Just a reminder again. Thank you, Suzanne.
Thank you. Polly, anything from you? Final words. Just to say thank you, really. I mean, I feel really fortunate to have been a participant of the pilot scheme, and it really has helped me develop, just helped my confidence. It's brought friends, not only networks and collaborations, but friends as well. There's so few schemes like this. I mean, you've got absolutely nothing to lose to apply. 100%. Thank you.
Thanks, Polly. And last but definitely not least, David.
Thank you. It's been great to be with you all. Just one point, I'd probably just reinforce the importance of really having conversations with your employer. I know we've asked for a letter, and that's essential, but you really do need to have them on board with you, and also to demonstrate the real value that you're going to bring back to the workplace, which is exactly what I'm sure you're fully intending to do. So those conversations are important. Also, just be thinking about extending your thoughts beyond your own employer trust. We have this question earlier about mentors from other trusts potentially. We are aiming here to develop a community of interest in your specialism, and also on a multi-agency perspective. So the more thoughts you can bring into your application around you to demonstrate your real thinking, well, in my view, provide you probably a better chance of success than just something that has been quite well thought through. So it's not the detail of thinking it through, it's the actual concept, proof of concept, and the collaborative thoughts you might have with other colleagues in the system.
That's great. Thank you, David. And that was the point I was going to raise, actually, the importance of those early conversations with your, the person that's going to write that letter may well be the chief nurse, but you also need to talk to your line managers as well, because they're the ones that are going to need to release you. And so it's really important that you have those, and they really understand what it means in terms of losing you, perhaps from the clinical area on certain days, enabling you to have time to do some of the activities, but also facilitating you to network and develop within the trust as well. Because I think what's really important is that this scheme, like the NIHR more broadly, is looking to develop research and clinical leaders of the future for the NHS. So it can't just be about developing your research project, it's about developing you as a whole. Remember, the NIHR are interested in the person, the place, and the project. And so you need to think about developing all three elements of that through the scheme. So no more questions have come up into the chat. So I don't know whether that means that it was all completely clear as mud, because last time when we did this last year, we were inundated with questions and we almost ran out of time. So I'm just going to give people the last opportunity to raise any questions that they might have on reflection of what we've just said.
So while we give people a moment, just to let you all know that this session has been recorded. As soon as I download it from Zoom, it will be added to our YouTube channel and shared with you all. Please do feel free to share it with anyone else you think might be interested. It will be sent to all of you who have attended today, but also all of those who registered but couldn't attend. Suzanne, if you're happy for me to, I've converted the presentation into a PDF and amended Tina's email address on there. Are you happy for me to send that out as a PDF alongside the recording?
Neil.
Perfect.
Of course.
Cool. I'll do that. Fantastic. Thank you. It looks like that's all the time we've got. It looks like there's no more questions.
There might be one more question in the chat.
Through. Perfect. Do you think this scheme has helped fellows carve out clinical academic posts within the trust? A big issue for some of the CDRFs I know who are now returning to clinic.
So what I would say is that based on the evaluation data that we've collected thus far from our fellows, it's helped to have conversations in the trust, and it's raised awareness of the need to have these conversations in the trust and to think about this. I think in particular the debates have really helped, because the two debate topics have really focused on the role of clinical academics. But I think I'm going to hand over to Polly to answer that question a little bit more, because I think she's well placed to answer that.
Thanks, Suzanne. I think everything you said is right. I think it raises the conversations. It starts the conversations. It raises the awareness that we're here. It's slightly different in every trust and what role you are and who you are, isn't it? But that's what we're all trying to do, and that's what this scheme is supporting us to do. And it's how you use it and how engaged your managers are and how much they're listening. Some people have had more success than others. The scheme, the 10 of us that have gone through the pilot scheme, and interestingly, this afternoon it'll be really interesting to hear where people are at now. But it's all there to support us, and it's trying. We're all trying, and we've got a little road to go, especially in nursing, definitely. But yeah.
And I think one of the values of the scheme is, as Polly talked about earlier, bringing together professionals from very many different healthcare professional groups, and some professional groups are at different stages of developing clinical academic careers than others. And so I think that learning about what has worked, what hasn't worked, how we can navigate the complexity and the challenges is part of the importance. And I think the scheme has also helped some people to think about whether they do want a clinical academic career as well. And sometimes you can see that as a negative outcome from the scheme, but actually I see it as a real positive, because clinical academia isn't for everybody, and actually working out what is the right route for you is as much a part of the scheme as whether or not we do get a final NIHR application. David might not want me to say that bit, but I do think that's important as well.
No, actually, I'm nowhere near anything, but I do actually support you completely on that. But I do think what I'd like you to think about as well is the contribution that you're making, one, through your current thoughts and your motivation to undertake such a career, but also the difference you're going to make with regard to clinical excellence within your local networks, with your local patients, and obviously your local citizens, as we start to really get this new approach. So think about new approach. I mean, integrated health and social care and primary care within local populations. I do really think it's important you think about that, because if you can act as ambassadors to really start to mobilize new leadership, clinical leadership approaches with new concepts of care, new ways of engaging our patients through co-production, that's what we're really about. The NIHR fellowships are important, but you can do an enormous amount by disseminating and diffusing best practice. And it's that evidence we want to see locally across our trusts in London.
We have one more question. Given we can only apply for the other NIHR schemes a max of 2 times, would you recommend taking some time out post-PhD to spend some more time working clinically and apply for a bridging scheme before making the first postdoc application?
I think that's a very individual decision. I think it's hard for us to tell people what's right and what's wrong. It will really depend on them as individuals. but I do think the bridging scheme can really provide really useful period of time for people to reflect on where they're at already, where they want to go, what they need to do to get there, and then ultimately to produce a more competitive application to the scheme at whatever point they choose to apply for it. So I think that's probably what I would say. I don't know if anybody else on the panel wants to add anything to that. I'm presuming they agree with me then. I hope that, I think it's a bit of a roundabout way of answering your question, but I think it's very hard to say, to give definitive guidance.
Fantastic. Well, thank you, everyone. We've got some thank yous coming in. So Paula says, thank you for the scheme and articulating so well the challenges and benefits of clinical academics for healthcare. We will end it there. Thank you all for being here and for taking part. We'll send that out. We'll send the recording out shortly along with the PDF of the slides. Thank you so much.
Thank you, everybody. We're looking forward to all of your applications.
Bien.